Despite huge leaps in biological research over the last decades, cancer therapy for most patients has remained much the same. New technologies for things like DNA editing, protein engineering, and so much more have sprung up over the last couple of decades and by now have become commonplace in biological research. These technologies have enabled us to analyze and manipulate cells on a much more detailed level than before, which has helped us improve our understanding of many diseases. A better understanding of cancer has led to the development of some new and exciting therapies. But anytime knowledge has to go from a research laboratory to clinical implementation, there can be quite a delay. And cancer is a complex disease, so models in a lab can be quite different from what actually ends up happening in a patient. For the most part, they're restricted to a selection of treatable cancers. The majority of cancer patients still have the same options: chemotherapy, radiotherapy, or surgery if they're lucky. At least that's the case for standard therapies pursued in most clinics. However, research has also shown a light on many non-standard interventions with strong anti-cancer effects. But despite promising research to back up their use, these interventions have yet to become widespread, in part due to lacking financial interest. And whilst it's pretty depressing that cancer patients are suffering more than necessary, there's also a bright side that many of these non-standard interventions can be implemented by cancer patients safely at home.